Welcome back. As health officials around the world respond to the outbreak of the coronavirus or COVID-19, concern here in the U.S. continues to grow.
But what can all of us do to help minimize our risk of infection? ABC4's medical correspondent Saray Chin reports on how to improve your chances of staying healthy.
Now that coronavirus or COVID-19 is in the U.S., many people want to protect themselves. According to Dr. Robert Wiley of Cleveland Clinic, the virus spreads through droplets when people cough or sneeze. So your first line of defense is good hand hygiene.
Make sure you do a lot of hand washing. So if you're shaking hands or you're at different places, then hand wash and avoid touching your mouth, your nose, or your eyes.
If you're coughing, cough into a tissue or into your sleeve. The virus is more likely to spread by people who have symptoms, but those without symptoms could still be contagious. For extra precaution, keeping a safe distance from others can be helpful.
If it really becomes a significant problem, then social distancing. In the United States, we're recommending 6 feet. The World Health Organization is recommending at least 3 feet, particularly if we're approaching people who might be infected or may transmit silently and we don't know whether they're infected or not.
Some people wonder if wearing a face mask can help prevent illness. So far, there's no evidence face masks will keep you from getting sick.
Right now, the CDC is not recommending that we wear face masks. It is effective if you have the disease. And you can imagine if you're coughing, the face mask will catch some of those droplets and make you less infectious. But there's enough room around the sides, around the nose, and under the chin that it's not going to completely prevent that droplet spray kind of coming out.
Dr. Wiley says the majority of people who have become sick from COVID-19 have had mild symptoms. He adds, if you think you have coronavirus, it's important to call your healthcare provider first for instructions before coming into the office. Saray Chin, ABC4 News.